Welcome to LearnFast Australia. My name is Colin Klupik. Today I'm talking here with Devon Barnes, the Clinical Director, and we're just trying to get an idea of an overview of where to get some help. Devon, it's been said that it's quite a minefield out there when it comes to experts. What exactly do you specialise in when it comes to learning and literacy?
What I attempt to do is to understand the whole child and, with my assessment, look at all the underlying processing skills that a child needs to be able to learn effectively. So what I'm looking for are the glitches within the children's learning profile. So I'm looking for the differences that they have in terms of their ability to use language, and I'm looking for the differences in their ability, their reading skills, based on what science tells us are the underlying factors we need to be good at reading and learning.
Now, the field of neuroscience has become a little bit more popular, or we've become a little bit more aware of it, say, since about the mid-90s. Is that correct?
Yes, that would be right.
Okay, and particularly the use of technology in neuroscience.
Mm-hmm.
How has neuroscience contributed to the way you work?
Neuroscience has contributed enormously to the way I work. Firstly, it enables us to, with the development of technology such as magnetic resonance imaging to look at brains, we can look at the brains of people with and without a difficulty. For example, the brains of people without a reading disability and those with a reading disability, and we can see how those brains are different. We can also then use that brain technology to look at the effectiveness of intervention programs. So we can look at brains before and after an intervention and actually see how those brains have been changed with the intervention. And knowing that the other aspect of science is, what are the critical skills that are brain-based that we need for learning and reading? And we can then look at the parts of the brain that are critical to the development of those skills and know that we've actually stimulated or increased the efficiency of those parts of the brain that are critical for learning.
And how do you see neuroscience contributing to learning theory in the future in terms of the way that you'll deal with your students or your patients?
I think with all science, it's an ever-evolving field, and we all want to be able to provide the most effective outcomes for our students. So we use science to drive what we teach and how we teach to get the most effective outcomes. So within my practice, we look to what research tells us to inform what we do and how we do it. And I think this, the neuroscience is just going to give us more and more information in how to do our job more effectively.
And the Fast ForWord program is an outworking of that neuroscience.
Absolutely. The Fast ForWord program came out of 30 years of neuroscience research, looking at why some children, who in every other respect are perfectly normally developing, don't develop language, and I'm talking oral language and written language, reading and written language. What is it about those children's brains that's different? So that research was able to show some fundamental differences in the brains of children with language and reading difficulties. Out of that research then came a tool that we as clinicians could use in our practice to rewire those faulty parts of the brain. So looking at those brain systems that were different, how can we make those more normal so then our students could develop language and reading and written language more effectively?
Devon Barnes, thanks for your time.
It's my pleasure, Colin.